talk a little about consumers, if you would, and why you think that's important.
Well, these things go together. And the idea of the health savings accounts is that people should be able to manage some of their own healthcare dollars. And when they're managing their own healthcare dollars, they're spending their own money rather than someone else's money. Under the third-party payer system, insurance companies or employers or government pay all the bills. And if someone else is paying the bills, we're not going to be careful consumers. We're not going to worry about costs. Our incentives are to be very wasteful. And over on the provider side, on the doctor's side, if Blue Cross is paying all the bills, the doctor tends to look to Blue Cross to decide what to do. These incentives are distorted when a third party is paying the bill. The patient's incentives are distorted, the doctor's incentives are distorted, and we get lower quality care and we get more costly care. So you empower the patient and the market changes. If you look everywhere in healthcare, it seems like the market doesn't work very well, except in those areas where there are no third-party payers. So show me a medical market where there's no Blue Cross, no employer, no Medicare, and it probably works pretty well. And one market that comes to mind is the market for cosmetic surgery. We pay for that out of our own pockets. The demand for that, those kinds of services have really soared in the last 2 decades. There's price competition, there's quality competition, and the real price keeps coming down, even as the price of every other kind of surgery keeps going up. Another area is LASIK surgery. Here again, we're paying with our own money. We have price competition, quality competition, real price going down. Those are examples of medical markets that work really well, in contrast to everything else that's happening in healthcare.
It seems to me that the pricing models are also inequitable in that they treat humans differently, right? So the price that you would pay, for example, under an insurance plan versus a Medicaid plan are going to be wildly different, and yet again different under a Medicare plan. So it seems to me that there's a dehumanization in that. And if I'm a person on Medicaid, I would say, well, why is my pain or my injury or my illness worth less than somebody else's? It seems to me that that's a dislocation in our market. Am I mistaken there?
Well, if you think about a doctor's office, primary care doctor, he's getting paid by a lot of different payers. You mentioned Medicaid. There can be different employer plans, the insurers, Blue Cross, Humana, others, United Health, and there tends to be a different rate paid by every one of them. Now, why you should care as a patient is that if you're in one of the plans that pays a really low rate, you'll be one of the last ones the doctor wants to see. So it used to be, we said Medicaid was the lowest rate paid. So the Medicaid patient has the hardest time finding a doctor who will see him. And when he finds one, he'll typically be the last in line to see that doctor. Now we have Obamacare, which in some cases is even worse than Medicaid, because they tend to pay Medicaid rates, but that's combined with managed care. And what I mean by that is there's some likelihood the insurer will argue with the doctor and not pay the bill. So that's the patient the doctor wants to see last. So all this affects access to care. And, the average wait in the United States to see a new doctor is 3 weeks. But if you're on Medicaid or you're on an Obamacare plan, it can be even longer than that. This is not what I would call universal access to care.
So it seems to me that we would agree that third-party payer systems fail everyone, perhaps except for the insurance companies, because they fail the patient in terms of precluding them from access or creating a barrier to access, certainly being expensive. They create a tremendous amount of risk for doctors because not only do doctors have to do follow-ups and they have a claims process that they have to go through, their cash flows are challenged by virtue of the delays that insurance companies have in paying them the bills. They have civil and criminal risk by virtue of the codes that they may enter incorrectly or correctly, as the case may be. And So the model seems to only really work for the insurance companies. And I don't understand how, well, I guess I do understand how insurance companies have gotten so powerful, but the real question is, how do we move away from this model? One thing is obviously HSAs, which you put in place with uh, President George W. Bush back in 2003. Talk a little about that process and how you were able to navigate that into legislation.
Well, to back up a bit, I wouldn't say it only works for the insurance companies. What I would say is that everyone in the system faces perverse incentives because no one's looking at real prices. No one faces the incentives that you would face in a normal market. And so over on the provider side, the incentive is to maximize against whatever payment formula the third-party payers are using. So you start with Medicare, and then many private insurers take Medicare and follow their lead. But the incentives are to do what you get paid to do. And that's why when you go to a doctor, there are lists of things that Medicare pays the doctor to do. Actually, there's 7,500 tasks that Medicare pays doctors to perform. But until recently, the telephone wasn't on the list. Email wasn't on the list. Zoom and Skype weren't on the list, so you didn't get those services. But there are other things that aren't on the list, like helping you find an inexpensive CAT scan or MRI scan, or helping you decipher what drug would be best for you to take. Patient education in general is one of the things that Medicare doesn't pay doctors to do. So this is the worst way to pay any professional. If you paid a lawyer that way, your odds of being convicted in a criminal trial would go up a lot. So you don't want to pay professionals by task. Doctors, accountants, other professionals, either they get paid one lump sum to do something, or they get paid by time. And the way we pay doctors and the way we pay hospitals greatly distorts the incentives they have and the way they practice medicine.
It seems to me that we ought to be encouraging people to put more money, if they can afford to do so, into HSA, so they have more flexibility in their premium payments, because they're first risk, and that way they ought to be able to create more savings by managing their spending better. But I don't see that happening. And it feels to me like the insurance companies increasingly encourage people to treat health insurance as a layaway plan for health. It's not really health insurance to provide against financial catastrophe. It's instead a layaway plan so that somebody else is responsible for your health care. And so it frees the individual to make good and a lot of times bad decisions around their own health care.
Well, back in the beginning, we were accused of creating an account that benefited the healthy. And it's certainly true that if you are healthy, if you never see a doctor, the health savings account is probably the best savings account there is. It's better than an IRA, better than a 401k, and we can go into some of the reasons for that. But it's a wonderful savings account. But what we overlooked was that this could also work for the chronically ill. And right now, it's not designed that way. If you put $3,000 into a health savings account every year and you're diabetic and you spend that much on diabetes, it's just money in, money out, and you haven't accomplished anything. But 70% of the money is going for chronic illness. And studies show that chronic patients can often, with some training and education, manage their own care better than traditional doctor care. So my argument is, well, if we're going to let them manage their own care, let's let them manage the money that pays for that care. And then if they comply with their drug regime and they make intelligent decisions and save money, they get to keep the money they save. And so we could change overnight our treatment of chronic illness and have better outcomes and spend less money if we would be creative in using these accounts for that purpose. But we need Congress to allow us to do it.